Hi, I'm Dr. Mike Evans, and I think quitting smoking is a journey. For some, it's a short journey full of resilience, but I think for most, it's a long journey, a long affair, if you will, of quitting and relapse. A complicated relationship that can have as much to do with a person's relationship with themselves as with the cigarettes. What starts as a pleasant sensation, an opportunity to rebel, or even to belong, is replaced by less pleasure and a feeling of being trapped. A daily or hourly ride of nicotine withdrawal, and then another cigarette which brings relief. Most teens who smoke think they will quit in their 20s and actually don't till their 40s. Stopping smoking is about making a change, and that is something we're not too good at. When I think of change, I think of two concepts: where you are at and the mechanics of how we change. So we should start where you are at. When I started medical school, I thought I could take somebody who smoked and convert them into a non-smoker in one fell swoop. Now I see it differently. I focus on where the person is at. You may be in what we call pre-contemplation, where you're not really even thinking about change. Approximately 75% of smokers want to quit, but 25% are not interested. Maybe you're at the contemplation stage, thinking about it, but not quite ready to act. Next is preparation. This is critical with smoking, especially in the likely event that you've tried to quit before. What has worked in the past and what hasn't? What caused the relapse? Maybe you're at the action stage. This is when you're ready to make your move. There's never a perfect time to quit, and at one point you just have to jump. I'll tell my patients, hey, it's going to be a challenge now, and it's going to be a challenge in 5 years, so why not do it now? And finally, there's the maintenance stage, where you become a non-smoker and are trying to stay that way. When we make changes, it's critical to stop and think, how important is this change to me, and how confident am I in making this change? What we call your self-efficacy. Your job is to be honest. My job is to see if I can move your scores towards 10. The second concept is about the different parts of change. So there's the what. What are we changing? With smoking, I suppose it is straightforward, stopping. But if you think about it, you might be changing lots of things. I think it is like a relationship breakup. You start by just keeping things simple and low risk. You might break up your routine a little bit, avoid certain places, maybe use that juicer every morning to distract yourself, but you will need to change more than your smoking to stop your smoking. The next is the why. Why change? I feel like I could do a 10-minute video just on all the medical reasons why not to smoke, and they are legion, but I'm going to spare you. Partly because you already know, partly because you don't need any more guilt, and partly because in clinic I actually spend more time asking people what they like about smoking. Which sounds funny, but I think we have to recognize there are positives, or at least perceived positives, and I think it's important to reframe these perceptions if we are to make a change. So let's run through a few of the common ones. Cigarettes are my friend. They de-stress me. They relax me. I'm not going to deny that you may feel a sense of relief and satisfaction when you have a cigarette, but I see it a bit differently. You have a nicotine addiction. The nicotine in tobacco is highly addictive. Within a few seconds of inhaling, it travels to your brain, causing you to have a temporary high. Over time, your brain changes, causing you to smoke more to get the same effect. We rate your addiction to nicotine with a few simple questions. Do you smoke more than 15 cigarettes a day, or smoke within 30 minutes of getting up in the morning? Do you find it difficult to go more than 4 hours without a smoke? The power of nicotine comes from the repeated small doses you give yourself when you smoke. It may seem innocent at first, but if you take 15 puffs from a cigarette and smoke, say, 20 cigarettes a day, that's 300 drug doses a day. You think smoking relieves your stress or is satisfying, but it actually isn't. The cigarette is just making your nicotine addiction go away. Smoking doesn't make your concentration better. It just calms your nicotine receptors' cry for more. Smoking makes your heart beat faster, increases blood pressure and breathing. These are all symptoms of stress, not stress reduction. Let me repeat that. The cigarette just reduces your nicotine stress, not your real stress.